Welcome to episode number 12. I'm Dr. Jesse Morse, your host, and this is the Eternal Vitality Podcast. I am a family and sports medicine physician practicing in Miami, Florida, and we are going to talk about a fascinating topic today called ozone therapy. Now, if you haven't been here before, I recommend you consider checking out some of the episodes before this, as we are on episode 12, so there's been plenty of different topics that we talked about, anything from quote-unquote stem cells to PRP to testosterone to peptides to methylene blue to depression and how ketamine can help America's broken healthcare system. I'm sure there's something that you can learn from and resonate with. If you haven't listened to a podcast before, one of mine, my goal is really to educate and to try to help as much as possible, obviously free of charge. Today's topic is one that I found very fascinating about almost 5 years ago when I transitioned from traditional practice to non-traditional private practice. And I went from a sports medicine orthopedic office to a more regenerative medicine and functional medicine office. Now, one of the things you will notice is the majority of my topics are not things that your traditional doctor covers. And that's not by design that I'm just specifically talking about other things. I'm using tools that we don't traditionally use in medicine to help people in different ways. And a lot of the times there's not good information on these because a lot of the American doctors are not trained in these. They're not comfortable with these. Most of them never even heard of these. It's amazing how insulated we are as a medical society. It's almost like a horse with blinders on. Either you see it every day and you're used to it, or you never see it, never hear of it, and almost think of it as taboo. And unfortunately, that can happen. So if you're not getting the results you're looking for, if you're looking to step outside the box and stop doing your cortisones, your oral steroids, your different what I call Band-Aid medicine that are predominantly management, and you're looking to actually treat the underlying problem, get to the root of the problem, that's the type of stuff that I talk about. Now, the topic today is one that you've probably heard of before. Ozone, like the ozone layer, is O3, oxygen plus a single oxygen molecule. Now, you probably have never heard of it in a medical context, and if you have, you're probably already on, in a functional practice, or you're from a different country. They're not super common in America. Now, what you'll understand is that, what you'll learn is that we have a lot of different things to talk about. There's a massive learning curve here. And this is not a new med. This is not something that just came out, a year ago, 10 years ago, 50 years ago. The origins of ozone date back to 1785. When a Dutch physician scientist kind of discovered it. There was a lot of things between now and the 1885, but in 1885, the Florida Medical Association actually published a book on ozone. Then in 1896, 11 years later, we had the first homemade ozone generator by none other than Nikola Tesla, the brilliant discoverer of many different things. Now, there's a lot of things between now and then, but what I want you to understand is that this is not a new drug. This is not a new substance. So what is it and how do you get it? So in the environment, there's a couple different ways to get it. The sun predominantly makes it, and then there's lightning strikes that technically make it. So there's the ozone layer, which you obviously know about, that quote unquote protects us, but you can actually harness the power of ozone for many different diseases and illnesses, and we'll talk about all these different things in a little bit. All right, so what is ozone? Ozone is when you have an oxygen molecule, you smash it with another O2, and what happens is you break off a single oxygen molecule and it jumps onto the main oxygen molecule to become O3. Now, when this happens, that's where we're forming what we call an ozonide. There is only about 1 to 3% of ozonides that form. but even that is super powerful. Now, what you need to understand about these is they're inherently unstable. They don't like to be in that formation for a long period of time, but they are really potent. They traditionally, and we'll talk about this a little bit, but they really can, I wouldn't say kill viruses, bacteria, fungi, all things, but they make the environment so challenging that it makes them very tough to live. Now, what you have to understand is that ozone is essentially a form of oxygen. So at the end of the day, I call this oxygen therapy. It's a modified version that we use in very unique ways. I'll tell you about the different ways we can get it in a little bit, but I want to explain to you why it's almost a magic bullet and why we can use it for so many different things. It's not because of what it is, it's because of what it does in the body. Now, if you think about it, as we get older, our oxygen utilization, how well we perfuse, drops. That's part of the reason why we age. Our mitochondria, our powerhouse, have a tendency to become less and less efficient, almost like a car engine that stops kind of running as well. And then as the car engine starts to die, we kind of start to die. What ozone does is it helps to improve the oxygen utilization. And in particular, it helps to normalize what we call the NAD-NADH ratio in the mitochondria. Now, you've probably heard of NAD before. NAD is a very important substance that we have in all of our mitochondria, in pretty much every cell in our body, thousands and probably millions and millions of them, if not more. They are used as a supplement for anti-aging and a couple other things. You can measure the intracellular levels as an anti-aging test. But what's important here is the NAD to NADH ratio. Now, if that ratio starts to dip, we have significant problems with our health. Our immune system is not doing well. But if you can improve that NAD to NADH ratio, you can actually improve your health in many, many different ways. Now, so that's essentially what ozone does. So you have an ozonide and then you have NADH that can formulate water as well as NAD and oxygen. So that's the relationship that it formulates. So if you think of this accumulating disease in the mitochondria as aging and then developing these degenerative diseases, whether it's a skin issue, whether it's a liver issue, whether it's a heart issue, you can have problems in the brain with dementia. Anywhere in the body we have degenerative issues that just don't function as if we were younger. Now, people who are aging and who are chronically sick and chronically in pain, they have the ability to reverse some of these symptoms with ozone, which is pretty amazing. A simple gas that can actually help you in many, many different ways. Now, all diseases actually improve with the improvement of oxygen utilization. And that's exactly what ozone does. So that's how it has the ability to be that magic bullet, because it's basically helping the engine run more efficiently. And you need engine for every single one of your cells to function. Once the engine starts breaking down, we start developing diseases. So if you found something that can help keep that engine running more efficiently, that's the key to utilization and to staying healthy and addressing diseases. Now, there's a bunch of different schools of thought. I'll talk about that in a little bit. But in general, some people say you do a little bit weekly or biweekly or monthly. And then some people say you do a big dose, but less often. Now, there are some specific contraindications that you have to know about with ozone. This is not something that you just randomly start doing because you may have issues with it. First off, if you have something called glucose 6-phosphate dehydrogenase, or G6PD deficiency, you cannot use ozone. You will have serious issues. I've seen it in person. Unfortunately, your body is not able to break down this molecule, and you will feel worse. That is much more common in a Mediterranean descent, some African descent, but now we see it in all different people. It's a simple blood test that we check. We check it on all of our patients. but it is not a traditional test that most people are going to check for, but it's a simple thing that you can do on your blood panel, not a big deal. G6PD, and it's either positive or negative. Either you're normal or you're not. That's pretty much it. Now, the other contraindications, hyperthyroidism, meaning you're making too much thyroid that causes a lot of problems with ozone. If you have low platelets, meaning under 50,000, it's too risky for you until you get it up. Cardiovascular instability. If you're inherently unstable with your heart and you have bad heart issues, not a good idea to use ozone at that time. If you are drunk, if you're acutely alcohol intoxication, not a good idea. It will cause some problems. If you had a recent heart attack or a recent stroke or a seizure, not a good idea to do ozone. You have to wait for the body to heal up a little bit because it will cause too much stress. And finally, there's a couple more. Anyone receiving iron or copper treatments or have too much iron in their body, what we call hemochromatosis. Those are the major contraindications to ozone therapy. Now, it's important to understand that there are relative contraindications, which basically means that it's not a hard and fast rule. It may be more of a tolerance issue. So usually you start off slow and you go up. Now, we're going to transition to what I call the second section. What do we use this for? And then the third section, I'm going to talk about how are these different, what are the different ways to get it? It's a gas, but what do you do? Do you eat it? Do you drink it? Do you inject it? Like, what do you do? So we'll talk about that in a minute. But the beauty of ozone is that it has so many different uses. And that's why you say, hey, what do we want to do for this? Ozone. And like, why do we use ozone for everything? Because it addresses that oxygen utilization. It optimizes it. It helps with that NAD to NADH ratio, and it helps to fix a lot of the stuff in the cells so that the cells can work normally. The other thing it actually does, this is brilliant, is it actually has the ability to shift what we call the oxygen dissociation curve. So basically what that means is it actually forces the oxygen into tissues that don't heal well, which is amazing, and why it helps to heal tissues that don't heal well, i.e., issues with feet that are really, really poorly vascularized and necrotic. We've saved several people's feet with ozone, and we call limb bagging. So it's very brilliant, very simple, very straightforward, very inexpensive, very effective. Now, the cool thing about ozone is that we can use it for so many different things. It works amazing for bacterial and viral infections. When COVID was happening, it was part of our protocol at my office, the osteopathic center, and we would do ozone, we would do vitamins, and then we would do high-dose vitamin C. And almost every single patient was feeling amazing, and their COVID symptoms were gone within a day or two. It just has the ability to boost the immune system, and so much so it actually shifts the immune system from an antibody-dependent, which is a slower, more reactive stance, to a natural killer dependent, or what we call T helper 1, which is essentially the front lines. So when that happens, your immune system is a lot stronger. So one of the things that we use ozone for is to optimize your immune system. So if you have a poor immune system, or you've had vaccines, if you've had any issues with any of the biologics like Enbrel or Humira or any of those indirectly, unfortunately, lower your immune system by the way that they work. Ozone can help with optimizing that immune system, so you kind of balance it and shift it back into your favor. I do ozone probably once every week or two. I recently had my epigenetics tested to check my immune system, and my immune system is 19 years younger than I am, to give you an idea. That's pretty impressive. And I attribute a lot of that to ozone and to some of the different things that I do. But you can definitely check that. That's something that you can check. It's basically measuring a CD4 to CD8 ratio. Now, let's transition to some of the other things that it can help with. Health optimization. which is exactly what it sounds like. Mitochondrial dysfunction, which we talked about earlier. Anti-aging. It's part of my anti-aging protocol. It's amazing for mold and mycotoxin poisoning, which sounds crazy, but it can. It's very effective for that. You can use it for preventative. Hey, I'm starting to feel a little under the weather. I want to get it so that I don't get really sick. Or hey, I don't feel good. I'm already feeling crummy. I want to make sure I don't get really sick. Ozone can actually be very effective for that. And some athletes and non-athletes that are just active will use this as a performance enhancer. I've had several athletes tell me this gives them another gear that they cannot get to if they don't do it. It doesn't last indefinitely, but it's pretty cool. The more ozone you infuse, the more effective and the more potent it can be. Now, what are the different types of ozone? So there's really only one ozone. You essentially need an ozone generator. And they're these little devices. We have a tendency to get ours from Germany because that's usually the most reliable. The American companies just continue to struggle, it seems like. There's a couple that are okay. There was a couple Canadian companies, but most of them are out of the business now because of the other reasons. So what do you do with it? So to make it easy for you, you pretty much do everything except for inhale it. You do not want ozone directly into your lungs. They used to use that with dry cleaning and stuff, 50, 60 years ago. That was counterproductive. That was very damaging to the lungs. A little bit you can inhale. It's not a big deal. A lot will unfortunately cause some issues. Now, you can infuse it into water. I have one here at the house. You can infuse it into olive oil and eat it. Or put it on your food. Every time you do that, it's capturing those ozone molecules, and it will hold it until it gets ingested. Now, it's not indefinite, but it will definitely hold it for a short period of time, and you can ingest it and then get ozone in, directly. The most common way is taking blood out of the arm. You inject ozone into it, and then you run blood back into the arm. You don't lose any blood. We're just kind of borrowing it. Now, you can do this rectally, which is very common for different types of GI issues, for gastrointestinal diseases, whether it's SIBO, whether it's C. diff, or constipation, or any of the complicated GI issues. Definitely can be helpful. You have to kind of get used to it. It's a little strange, but it's very effective. You could do it for vaginally for infections and issues up there, and you can even inject it. It's very effective for hair growth. Slow but effective. Not the most comfortable thing to inject in the hair, but you can, and it works. And you can also inject it into the joints. It's amazing for pain relief. It has this amazing quality that can get rid of pain. I've seen it get rid of pain in knees. I've seen it get rid of pain in shoulders very, very quickly. And the cool thing is, a lot of the times, it doesn't come back. Now, it may not address the issue that caused the pain, but it can neutralize the pain, why it's causing it, and what you feel as translating that pain. Now, the most common, as I mentioned earlier, is blood, meaning you take blood out, whether it's through a syringe or through a line. You infuse ozone into it, oftentimes with ultraviolet light or UVI, and then you put it back into the arm. Now, there's a minor, what we call a minor, which is the old school classic way to do it, that you draw out, we'll say 2 ounces or 60 cc's or 100 cc's of blood. You put it into a saline bag, inject it into it. Then you inject the ozone, which is a gas, into the bag. It will turn the brightest red you've ever seen in your life. It's like fire engine red. And then that will infuse back into your body. That takes about an hour or so. Now, we have more volumes that you can do, and they happen to be faster, just the nature of pressure. Now, ozone comes in strengths. They're called gamma. So they can range from 0 to over 100. Traditionally, depending on which school of thought you believe in, you could see anywhere from 30 to 50 to 70 to 90. Most of the time at our clinic, we're alternating between 30 and 70. If you do this, then you'll know what I'm talking about. Some people just keep it at a standard 50. Some people, including myself, can't handle higher concentrations. I get this burning in my lungs. I don't know why. So when I do it at 50, it doesn't really bother me. When I do it at 70, it gets uncomfortable for me. So that's why we just adjust it. I still get beautiful potency, but without the side effects. Now, when you're injecting it, you're traditionally not doing that high of a dose, usually around 20 gamma. It does work really cool in joints. It will feel when I inject it into a knee, because the knee is essentially a big balloon. I tell people you're going to feel like you're walking on bubble wrap for a couple hours. And like, oh yeah, I feel it, because it's air. It's a gas. But it will diffuse. It will help. It will heal things faster. For those of you that are doing regenerative medicine, the data shows you should not do it within 10 days to 2 weeks of any quote-unquote stem cell procedures, because as Dr. Schellenberger, who's kind of the guru in the United States, mentions, it's counterproductive for that, because it can be harmful to the new quote-unquote stem cells acutely. So you got to let it pass a little bit. Now, there's different parts of the world, not usually in the United States, I've seen some in the Caribbean, that directly inject it into the vein, what we call direct injection. This is very risky. Some people, this is how they were trained, so this is how they're used, but this is super risky, and I would not recommend it at all. Very, very, very risky. So that's not something that we would ever consider. It's just not worth the risk. Take the blood out, infuse it, and then put it back in, and you're good. You do never want to put a huge amount of air into an IV line. You will have a massive embolism, and there's a good chance you will have serious issues. Never inject directly if you can help it. Okay, so I hope that you found this helpful. You're probably wondering, like, where do I go to find this? The government's not a big fan of this. I'll just kind of give you an idea. This works great for Lyme disease. This works amazing for mold poisoning, for certain things. Unfortunately, it's not, traditional medicine, but it is amazingly effective. You just have to go to a place that knows what they're doing. This is not something you pick up on a weekend, but like, okay, I'm going to start doing it. No. The learning curve for ozone therapy is massive. I'm going to their conference in Orlando in a couple of weeks, their national conference, to see what the new, things. A lot of dentists use this for healing. It is amazing at addressing nerve issues in the gums. It's amazing at killing infections in the mouth. If you want a high-level dentist that is more homeopathic or more safer and cleaner and not going to use mercury fillings or anything like that, find a dentist that uses ozone. They are out there. I spoke with one the other day, and they do great work, and they are a lot cleaner and safer in the long run, given the different options that they provide. Now, if you were to look to try to find a place, what I would recommend is going on to AAOT. I think it's .com or .org, and that stands for the American Academy of Ozone Therapy, I think is what it stands for. And there's a practitioner search in there, I believe. There's not many, but there are, and if they're on that list, they know what they're doing. They're legit. I found some in Canada. I found some in Massachusetts. I haven't really looked. They're very common out west, Arizona, California, Colorado, and not super common on the East Coast. But if it's something that sparks your interest that you think can help you, and it probably can in many different ways, then that's something you should consider. Now, I'm going to elaborate on a little bit more of the different types of IV injections. So when you do the blood one, you could have a minor, which is only about 2 ounces of basically a shot of blood, which looks like a lot, but it's not that much. Then we have what they basically call a glass vial. So that goes from 2 ounces in the injection from the minor up to 6 ounces. When you do 6 ounces, you traditionally use an ozone machine that is going to pull the blood out with negative charge, fills up a glass tube. You then infuse the ozone into the tube while circulating it to help infuse it. Then you run that back into the vein with or without ultraviolet light, which further enhances the potency of it. Now, that would be considered one pass. Now, you can do that up to 10 times as traditional. Some people go a little higher, but that's usually not. And to give you an idea, that's about 35% of your blood if you did a 10 pass. Now, That's a lot of blood, but that's essentially what you're trying to do. The more you pump in, the more exposure you get, the more effective it is. Now, that is not something you can automatically jump to traditionally. I would probably start with a 1 pass or a 3 pass before you go up to a 5 or an 8 or a 10. Price-wise, this does get a little pricey, anything from a couple hundred to $800, $900, over $1,000 for something I'm about to talk about next. Now, the latest and greatest version of Ozone is what we call EBOO or EBOO or EBO2. Now, this is formed, Malaysia has this. There's different parts of Europe and Canada that have this. We started getting it more in America about in the past 3 or 4 years. But there was, in our opinion, there was issues with quality of the machines. This one's a little bit more complicated. So EBOO, the difference is basically pressure. Essentially what you do is you put a line in one arm, an IV in one arm, and then you put an IV in the other arm. And essentially what you're doing is you're pulling out of one arm, you're filling up the tubing. It runs through a dialysis filter, which filters out filters all the blood. It's very, very small filter, so really nothing gets through it. Mold, mycotoxins, heavy metals, bacteria, a lot of fungi, and viruses might be able to get caught in there. That will literally trap everything, and then ozone gets infused in there. You're going to get a lot more exposure to ozone because of how big the diameter and length of the tube is, and then it usually runs back through ultraviolet light or back directly into you, and you do that for about an hour. Now, the beauty of this is you're not taking it out of the same arm, so you have a constant flow, and it actually has a pump that's pulling it out, so you need kind of good veins for this. This is an amazing treatment. The difference between EBOO and EBO2 is the potency or pressure of the ozone. EBOO usually uses around 5 to 7 gamma, whereas you can have EBO2 that can jump up to 50, 60, so on and so forth. Now, we've had some patients that of other clinics that have done EBO2 and have had issues with it. We've had vomiting, they've passed out. We think there may be a hemolysis type issue. We don't really know exactly because we don't do it at our clinic. When we've done EBOO, we've done really well. Most people do amazing. And sometimes we start with the low gamma, and then a different visit will increase it a little bit until that we get to where they're comfortable. Now, the beauty of this is it's about 50% of your blood, depending on how fast your blood flows, which is it's a ton of blood. But the cool thing is you don't lose any blood. You will swap a little bit of some of the electrolytes in your fluid, in your plasma, which isn't a big deal because you replace those basically with saline or LR, which is basically the equivalent. But the beauty of it is you're actually filtering your blood, kind of similar to plasmapheresis, but you also use the beauty and the potency of the ozone. Now, that is called EBOO. Not many people do that. That is a very expensive procedure, $1,000, $1,200, $1,500 a procedure. But I've seen it fix things that you cannot fix any other way, that even the multipass has not been able to fix. So there's something about that filter, about the volume of blood, and just the way that it functions. It works really well. It's kind of a whole new planet because you start addressing things that you didn't think were fixable, or you could get symptoms down that you don't really know, that why, you're like, wow, I didn't think I would ever get rid of that. So it's pretty cool because of the way it works. Now, the last thing I will leave you with is make sure you find an experienced provider. This is not something you just wing because you can be harmed. There can be issues, You have to understand what it's doing in the body, how to connect all this. This is moving air all different ways. You're basically taking it from an oxygen tank and getting it, having a machine essentially smash those molecules together to create that small amount of ozonide to essentially formulate that oxygen therapy. So doing that, you really have to know what you're doing, what the side effects are, and this is not something that you just want to, fly by night and find someone who just figured it out. You want to have someone that's done hundreds or thousands of patients that treated with there. That will give you the confidence in understanding, yes, I know what I'm doing. I hope you found this helpful. This is an area that not many people talk about, but I wanted to talk about it because it is very effective. It is amazing what it can do. You just have to be willing to try something new, and you have to find a place that will do it for you. Unfortunately, this is not covered by insurance. That's a rate limiting factor for most. But if you're looking outside the box, or you want to try something a little bit more natural that's been around way, way, way before any med was ever created in the 1700s, Ozone is your tool. This was used for against bacterial infections before antibiotics were created. Unfortunately, my opinion, big pharma kind of started promoting your penicillins, your amoxicillins, and eventually everything else, and started to suppress ozone, because ozone's a gas and you can't market it. You can't really patent it. You can't trademark it. So in their opinion, you wanted to be able to use something that is, more marketable. But does it work? Boy, does it ever. Thank you for tuning in. If you like this type of content, do me a favor, smash this thumbs up, subscribe, maybe leave me a review if you wouldn't mind, to see, so I can show this to other people. Share this with your friends, your loved ones, maybe someone that you'd find this fascinating, or, hey, you're dealing with this disease or this issue, look into this concept. If you have any questions, I will happily put my email in the description, and you let me know. Thank you very much. Have a good night. We'll see you next week.